Lifeline by Sanjeev Medam, Ashwin Accapadi, Urmit Gajera, and Sachi Arora.
Hello, we are young entrepreneurs who plan to revolutionize medicine and provide individuals with a source of safety at all times. This is a mere start, but we believe it could lead us to beautiful endings. Without further ado, let's get started.
Before we get into the what, we need to take a look at the why. Farmers in India are revolting against the Indian government due to the government handing over the land's ownership to private investigators. This revolution is causing various nationwide riots, resulting in a mass number of fatal deaths and injuries untended to.
In India, we already have about 16,000 annual deaths, and with these riots going on, it spikes in numbers up to one death every approximate 32 seconds, which leaves us with one doctor per 10,189 patients.
Another important motivating factor is the access to healthcare. Rural villages in particular have limited access to healthcare, whether that is due to lengthy commutes to healthcare facilities or poor service and/or tools in rural areas. These farmers and villagers don't reach healthcare facilities in time, and the ones who do make it lack the financial stability to support the cost of impending medical expenses and may even commit suicide, leading to escalating suicide rates in the country. Hospitals all over India are overflowing with patients, leading to individuals needing to shift more than one hospital to find admittance, and the time traveling between each facility could be life-threatening.
Many farmers claim by the time we get to the hospital, we are not even sure if they will live or die.
It is known that 85% of India's farmers operate on less than or just about 5 acres of land. Farming being their primary source of income, they don't have much to spare for extraneous medical expenses.
Looking at this map, we can see three key areas in which access to healthcare is limited. As mentioned before, this is due to the location of healthcare resources, overpopulation, congesting hospitals, and poor access to up-to-date tools.
Well, what is our solution? Lifeline, an app that is designed to help individuals reach greater access to healthcare from the comforts of their own home.
The process is simple. Gather, analyze, and execute. We continuously gather data from nearby health facilities to update our app on hospital availability, the cost for the procedure, and distance to the facility. From here, our AI code runs each factor into a program and deciphers applicable healthcare resources for an individual's current situation. Once the code is run, the users can use the app to slide through possible choices in which healthcare facility they should travel to, given their approximate location, cost, and availability.
But that's not all. Lifeline provides its users with multiple benefits. Lifeline offers individuals with questionnaire-based diagnostics. Essentially, the family members of an ill individual can answer a series of pre-created questions to help determine what condition the patient is facing, what type of aid to seek, the average cost of aid, and the nearest location to receive that aid. Now, there are plenty of health conditions that can be treated without higher medical aid. For this reason, the app also has a list of pre-written remedies for multiple different low-level risks, such as fevers, colds, and sore throats. Finally, Lifeline has a built-in social network where individuals can chat with medical professionals for any medical-related questions. In essence, Lifeline provides individuals with the most intricate and developed health interface.
Alongside providing resources for individuals, Lifeline encourages individuals to look at their own mental health and safety. Lifeline allows individuals to stay healthy all over the comforts from their own home. Who could say no to that, especially in the midst of a pandemic?
The current customer base would be the rural farmers in India. In the three tiers of non-customers, the first tier, our soon-to-be customers, would be other residents throughout India. Our refusing customers would be those who prefer traditional medicine and other herbal remedies. And our unexplored customers would be people all over the world. We hope that the success of this app in India could spread to other nations to help those in need.
We can use the ERRC grid to compare Lifeline and Heal, a red ocean app that connects patients to doctors through booking house calls. First, we would eliminate house calls because doctors won't be able to carry necessary supplies for certain medical procedures. We would then reduce the need to book appointments as our app is only designed for unexpected circumstances. On the other hand, we would raise emergency services to care for extraneous situations. Finally, we would create a social networking page to provide users with efficient ways to communicate with doctors, first responders, and medical professionals.
Oh, and the best part, Lifeline is completely free across all app stores. We designed this app to reduce the number of lost lives, and we believe there shouldn't be a price on such an investment. However, we do require that each user sign up with username and password to ensure that their data is secure and stored for access from any device.
Let's start saving lives together. with Lifeline.